My name is Sam Meisler, and I'm a small animal veterinarian. In this segment, let's cover the basics of dog health care. And what I mean by dog health care, I'm talking about dog preventative health care. Your dog needs to be protected against diseases that are out there. And we do this primarily with vaccination. Vaccination against various diseases will help prevent it from getting those diseases. Some vaccines are better than others. Some just help prevent your dog but don't totally eliminate it. But some are very, very good. So vaccination is number one. And usually you do that on a yearly basis for some vaccines. Some vaccines are extended to 2 or 3 years out. Talk to your veterinarian about what they feel is the best treatment schedule for your vaccines. Taking care of intestinal parasites is also very important for your dog's health care. Doing at least once to twice a year fecal checks to see if there are any parasites in your dog. Very, very important. Even if everything's going normally, even if you have pretty much indoor pet or a very protected pet, some of these worms can cycle and their life cycle can go through and through your dog back and forth. So that is something to do. It's also good for protection against some of these dog intestinal parasites for you as a human. A study came out of the CDC recently. 14% of the human population in the United States have been infected with the dog roundworm. So that gives you an idea. We really need to watch it in our own dog. And it can present some problems for us, some very bad problems for us. So once to twice a year, fecal checks, very important. Possibly even a once to twice a year deworming at your veterinarian's office is important, even if the stool check is negative. It's helpful for your dog, it's helpful for you. Now, this brings us to another parasite, which is dog heartworm disease. Dog heartworms are out there. If there are mosquitoes out there, anywhere in the United States that has mosquitoes will have dog heartworms. So this is something that you can prevent by giving your dog a monthly preventative. There are preventatives that may last longer than that, and talk to your veterinarian about which preventative he or she endorses or believes in. There are lots of different preventatives out there. We use several at our office. Each one has some different disadvantages and advantages. Canine heartworm disease is preventable, and you need to make sure your dog's on a canine heartworm preventative. A lot of the heartworm preventatives will have monthly deworming against some intestinal parasites as well, so you can kind of accomplish that in the same medication. This gives you an idea of basic health care in the dog. Now, I think that it's also very important for your dog to have yearly physical examinations by your veterinarian. There are a lot of things that your veterinarian can pick up on your dog on a physical examination that would not be inherently obvious to you. And we can intervene in diseases early and try to prevent them from getting worse. Yearly physical examination, very, very important. Older dogs, you'll want to do this at least twice a year. Would you, as a 65-year-old person, when you're 65, would you just visit your doctor once every 3 years? And in dog terms, 6 months is every 3 years. So at least you want to do that. If you do in dog terms an older dog once a year, that's like going to your doctor as a retired person, as an older person, once every 7 years. You want to go more often than that. So that's why in older dogs we say go at least twice a year to your veterinarian. And you can govern this as well. Even if your veterinarian does not have a senior program for your older dog, just go in twice a year and say, I want to have my dog examined, make sure there's not any problems. We also recommend at our veterinary hospital doing some sort of blood profile every year to kind of see what the liver is doing, what the kidney's doing, make sure we don't have any underlying diseases. Dogs are very good about masking problems. When I do a physical exam, I cannot examine your dog's liver. I cannot examine your dog's kidney. That's why I like to do annual blood work. In senior dogs, I like to do it twice a year. Very important as part of your dog's health care program. This is not all-inclusive. There are lots of things we haven't mentioned, but that gives you the basics of health care in the dog and how to keep your dog very healthy, long years, good quality of life.